Upper lid blepharoplasty is just a big word for the procedure that helps to remove some of the extra skin that, in the upper lid area. Now, since I strictly do facial aesthetics, I see this procedure done frequently in the wrong patient. I'll have patients come in and they've had an upper lid blepharoplasty done, and perhaps they shouldn't have. And the reason for that is as we age, the forehead falls into the upper lid, and frequently what we need to think about, rather than taking skin off the upper lid, is putting the forehead back where it was. But if the patient is a good candidate for an upper lid bleph, it's a good thing, because an upper lid blepharoplasty is a fairly simple procedure. It can even be done without any IV started or any anesthetic other than some pills and a little local anesthesia, depending on the patient's wishes and desires. All it involves is making an incision in what we call the supratarsal crease, which is about 1 centimeter above the lashes. We make an incision that starts here medially and extends in a lazy S out to the lateral part of the upper eyelid. The surgeon's job when they're doing an upper lid bleph is to decide how much upper lid skin can be safely removed and how much muscle can be safely removed, so the patient looks better, but they can also close their eye. If you take too much, they can't close their eye. That's not good. If you don't take enough, well, they look better, but not as good as you'd like them to look. So that takes some experience to learn how to do that and do that in a reproducible way and do it well. So once you've decided how much extra muscle and skin to be safely removed, then you take that tissue off, and then you work on the fat pockets that are behind the eye. A lot of patients develop puffiness right here medially, some here in this part of the eye. Sometimes the fat needs to be recontoured so it doesn't protrude or puff out. And finally, when you're closing the eye, a step that is, I see frequently missed is what's called supratarsal fixation. And what that means is that when you're closing the upper lid, you should be putting some retention sutures in between this part of the skin on this part of the lid, and the muscle underneath known as the levator muscle, so that they have that crease there, what's known as a supratarsal crease. You can see when I lift the skin of my eye, it doesn't pull off the lower lid because I have a supratarsal crease. If you look at somebody who's oriental, they don't have a supratarsal crease. So in most patients that are wishing to improve the upper eyelid, they want to have a supratarsal crease. They don't want to have the skin that falls off their upper eyelid. So that's an important step for the surgeon to include in their upper lid blepharoplasty. Other than that, the eyelid is closed. There's a little minimal bruising and swelling for several days, and then the patient should be pretty much on their way and feeling good about their upper eyelids.